So one of the projects that I've been working on from the research side of things since I came on staff at Mayo Clinic is the development of an early detection test for endometrial cancer. In GYN, in gynecology, we've had a huge success when it comes to screening for cervical cancer with the PAP test and PAP plus HPV, but we do not have a screening test for endometrial cancer. Endometrial cancer is now the most common gynecologic malignancy that we care for in the United States. 1 in 50 women will develop an endometrial cancer. And when they come in to see me, oftentimes the question that I get asked is, you know, my pap smear was normal. How could I have cancer and have a normal pap smear? Well, the pap smear is not a test that's designed to pick up endometrial cancer. In fact, the sensitivity for endometrial cancer is only about 30%. The sensitivity of a pap test to pick up abnormal cells that indicate endometrial cancer up inside the uterus is only about 30%. But we know that there are molecular markers that are shed from cancers into other biospecimens, whether it's whether it's the peripheral blood or other downstream biospecimens. So the biospecimen that we have been focusing our research on is that of the vaginal pool. The vaginal pool is defined as everything that comes from up in the female reproductive tract and flows down into the vagina. So this could be fluid and material that come from the fallopian tubes, maybe even the ovaries. There is actually some data out there that suggests that mutations that arise in ovarian cancer can actually be detected in samples from the vagina and cervix. So we know that there is some downstream impact of that, or some downstream targeting of that. Also fluid from the endometrium, the uterine cavity, the cervix, and the vagina. So all of that is what's in the vaginal pool. We've been trying to design an early detection test using a tampon as the tool for collecting that biospecimen. And in that biospecimen, we look for molecular markers such as methylation or mutations. And similar to the most recent paradigm shift in colorectal cancer screening, which is that of the stool-based test called Cologuard, we aim to develop a multi-panel or a multi-marker test that will pick up endometrial cancer or endometrial cancer precursors and allow women to have the diagnosis earlier, ideally, and allow better access to care, because this would be a test or a specimen that could be collected in the comfort of a patient's own bathroom.